Good morning, Dr. Akusobi. Welcome back to my podcast, Leadership in Medicine. Happy to see you again.
Likewise. Thank you for having me.
Thank you for taking time out for this. As you know, this is a COVID vaccine special podcast, and we'll be talking about different types of vaccines and different types of immunities. And as all the audience know, that you are a graduate of Yale University, where you did your undergrad, then you went for your MPhil in Biochemistry to University of Cambridge, and you're currently pursuing your MD PhD at the Harvard Medical School.
That's right.
You're focused on the essential genes in non-tuberculous mycobacteria. So
Correct.
You're basically an expert that we have on virology, on microbiology, and immunology.
Yeah, I mean, I spent a long time in school studying microbes, so
right.
Happy to have this conversation with you.
Right. So we're going to start off with SARS-CoV-19 virus. Can you tell us a little bit about what the virus is? How is it different from other SARS viruses? And also, why is it so virulent?
Yeah, so the disease that we call COVID-19 is what we've all been experiencing. It's people who come in and they have respiratory illnesses. So they are like short of breath, hard to breathe in. And then unfortunately, some people go on and develop, respiratory failure. So an inability to breathe. And that disease is caused by a virus called SARS-CoV-2. And the reason why it's called SARS-CoV-2 is that it's really similar to SARS, which was a virus that emerged out in China in the early 2000s. So SARS-CoV-2, which causes COVID-19, is the virus that's really similar to SARS. But there's some key differences that makes SARS-CoV-2 so transmissible and so in effect deadly. And that is SARS-CoV-2, the virus, is much more efficient at causing infections in people. And because of that, people are more likely to be infected and also spread the disease. SARS-CoV-2 as a virus also can cause infections deep in your lungs, but also in your throat, as we call it in medicine, a nasopharyngeal area, which is basically your throat and mouth. And so because you have live virus there, it's more easy to transmit the virus that way. And so SARS-CoV-2 is a coronavirus, and coronaviruses are a family of viruses that can cause anything from benign cold infections, the symptoms of the common cold, all the way to SARS and what we now are dealing with, COVID-19.
Right. Piggybacking on that, why do you feel that this SARS vaccines that have come out, we have various kinds of vaccines. There's mRNA vaccine, which we know Pfizer and Moderna, and then there's Johnson's & Johnson's and also AstraZeneca. Can you give us some sort of a differentiation points between all these various types of vaccines, and which one do you prefer?
Okay, so the overall point of vaccines, let's start there. What is the point of vaccines? The overall point of vaccines is to give your body immunity or protection against some sort of foreign infection, foreign, substance, bacteria or virus. And so all vaccines have a way of telling your body, here's something that's foreign. Please produce antibodies. Please produce molecules that are going to protect you against that foreign object if you were to see it in the future. And so that is what vaccines do. They help you build immunity against infection before you actually see infection. And so the way that these vaccines differ is how they introduce the material that your body then has to recognize as foreign. And so you have RNA vaccines, which is Pfizer and Moderna. You have the Johnson & Johnson and the AstraZeneca vaccines, which use a different sort of technology, which I'll discuss. And then you also have like this foreign vaccine, which uses a different sort of technology that we'll discuss. And so but the reason why I want to start off with the similarity that they all have in common is that it's important to realize that all of these vaccines are basically giving your body a little bit of the COVID-19 virus in order for then the immune system to recognize it as. And so how do they do that? So starting off with the Moderna and the Pfizer vaccines, these are mRNA vaccines. And what mRNA vaccines are is mRNA is a short-lived genetic material that tells cells instructions on how to make proteins. And so what these vaccines do is they tell your cells to make a little bit of the virus's spike protein, which is the protein that's on the outside layer of the virus that actually is needed for the virus to infect your cells. And so this mRNA has actions to make this spike protein. When you are vaccinated with these mRNA vaccines, your body cells will produce some of this spike protein, which your immune system will then recognize as foreign and then build antibodies against. The really important thing to know for this vaccine is that this mRNA is short-lived. It is degraded. It does not last in your body for more than 2 weeks. And this is just a property that mRNA scientists have known for decades. And so what's really special about this vaccine is that it's actually giving instructions to make the protein, which then your body recognizes as foreign and can then build antibodies against. So that's what Moderna and the Pfizer vaccines are, the mRNA vaccine. The next class of vaccines are the Johnson & Johnson and AstraZeneca vaccines. And what they basically do is they have a what we call a vector, some sort of way of introducing the instructions, DNA instructions to your body to then make the spike protein. So again, it's very similar in concept with the RNA vaccines. It's just the way that the genetic material is packaged is different. And so that's what that's what the Johnson & Johnson and the AstraZeneca vaccines do. And then the third class of vaccines is like the Sinopharm vaccines, which is really big, which is produced by China and is used widely around the world as well. And those vaccines are what we call killed and inactivated versions of the virus. And so what they basically did is they take the virus and they inactivate it, they kill it such that it can't inform infection, but the virus itself is intact. And so when you vaccinate people with this type of vaccine, your body sees the whole virus and recognizes that as foreign and produces antibodies, but it doesn't cause an infection because the virus it's not able to it actually infects cells. And so those three classes of vaccines are what's currently being used right now around the world, and they all are providing protection against COVID-19 by providing immunity, by allowing your body to build up a response against the virus before it actually sees the virus itself.
Right. Thank you so much. And thank you for bringing up Sinopharm as well, because we have people across the world who have living in India, living in United Arab Emirates, living in Africa, who have taken the disease vaccine. And it is more like what the vaccines that we usually had for polio and smallpox and BCG, where they used to use live attenuated bacteria to bring about an immune response. Thank you so much for telling us that. And why is there so much misconception about the mRNA vaccine? Because a lot of people feel that this is a new vaccine. They don't know how mRNA works, but actually this has been in the works for a decade or more. I mean, people have been working on this. It's not something that is new, right?
Yeah, I think there's a lot of misconception exactly because of what you said. This vaccine seems new. And the reason why it seems new is because it came out very quickly. And so people don't really have a concept of what mRNA is and also how it works in the body. But what I always tell people is that mRNA vaccine technology has been in development since the mid-1990s. And so there's been over 20 years of research developing mRNA vaccine technology such that people could eventually use this really awesome technique to build immunity. And so the research has been going on for a long time. And it just so happens that just when the technology was ready to be like tested and used, there was a global pandemic that required the necessity to vaccinate lots of people very quickly. And so the technology has been around for a long time. Also, there was a lot of money, a lot of resources, a lot of time and attention poured into developing these mRNA vaccines against COVID as soon as it became clear that this was going to be a virus that was going to be with us for a very long time. And so the world's scientific community, research community, and pharmaceutical communities poured in a lot of money and attention into doing the phase 1, the phase 2, the phase 3 clinical trials, making that these vaccines were safe and that they were effective, and realizing that there's a real urgency to get people vaccinated in order to save lives. And already we've seen in countries all around the world that have been fortunate to have their populations vaccinated, that these mRNA vaccines not only are incredibly effective in preventing people from being hospitalized and eventually dying, they're also very safe too. And so the misconception, I understand it, it's a new vaccine. It came out relatively quickly in the grand scheme of things, but know that underneath the information that was provided about mRNA vaccines upfront to people, there's decades of research that went on behind the scenes to get us to this step.
Right, absolutely. Thank you so much for clarifying that. Also, a lot of pregnant women are very hesitant to take the vaccine. I know personally I've convinced people to move forward with that because getting the SARS virus is far more dangerous than having the vaccine. It is true that we do not have sufficient data at the moment for a lot of things because from what I understand, you can correct me if you feel, when they're testing the vaccines, they're not usually testing for how it impacts the reproductive system or how it impacts the pregnant women. But from what I have seen and read, I feel that it is completely safe for pregnant women and there are no side effects so far. Can you please tell us a little bit more about that?
Yeah, so I can unequivocally say this is data that has been published now that people can go and read. The vaccines, the mRNA vaccines for pregnant women are 100% safe. And not only are they safe, it's actually recommended by the CDC and recommended by other health agencies, including the American College of Obstetricians and Gynecologists, so ACOG, the organization that is sort of looking after women's health. These vaccines are not only recommended, people sort of really do believe that it's safe, and also in the baby's interest and in mothers to get vaccinated and protect against COVID. Because what you don't want is the flip side, which is being unvaccinated, pregnant, and get COVID, which actually pregnant women are at increased risk of having bad COVID-19 complications for a whole host of reasons. And so the CDC and ACOG are recommending that pregnant women get vaccinated. The vaccines are safe, they're effective, and they also provide passive immunity to your unborn fetus and right. As well. So I think I understand that there's a lot of misinformation out there about the vaccines affecting fertility. That is also not the case at all. There's no evidence whatsoever that these short-lived mRNA vaccines affect the reproductive system. There's evidence now coming that the vaccines are incredibly safe. They don't have harm to the baby, and they actually protect pregnant women from being sick. Yeah.
Okay. Another question along the same topic. A lot of women have complained, or at least feel, that the vaccine has changed their menstrual cycles. Excuse me. That they feel that they've become more frequent, or there's spotting, or that they're having heavier than usual periods.
I haven't seen any of that. That is, if that sounds like anecdotal experiences, that definitely needs to be looked into if that is the case. But I haven't looked at that specific issue, so I don't feel comfortable like speaking on that.
Right.
But if that is, I would encourage people to look at like the CDC's website and look at other resources to see if this is an experience that other people are feeling. I will say that, over 150 million people have been vaccinated against COVID with mRNA vaccines, and the CDC is doing a really good job of monitoring any adverse reactions that may happen. And so if this is something that is occurring at a massive scale, that it would have been released and sort of investigated. But again, I haven't seen anything, and so I would encourage people to ask their doctors, but also look online and see what information is out there.
Right, and absolutely. And I think this is very important because, again, there's a lot of misinformation out there, a lot of people who are sharing all kinds of stories, and even if it is not connected to your vaccination history, it's something that they feel, or maybe subconsciously, that it's connected somehow to the vaccines that they've taken. The next question is that, do you think that masks are actually helpful? Do you think the kids should be wearing masks at school?
Absolutely. I mean, there's no question. Masks are the cheapest, easiest, most efficient way that we can protect yourself and others against COVID. And the reason why is because COVID-19 can be spread by airborne, which means that by talking, by singing, by shouting, you're actually producing microscopic particles that contain virus that can then go on and infect people. And so what masks do is that they cover your mouth. And so you're less likely to transmit those particles. But not only that, if someone else is speaking, shouting, singing, your face, your mouth, your nose is protected. And that's the main point of entry for this virus. And so there have been numerous studies, not only for COVID-19, but for so many other viruses that are transmitted via, droplets or via airborne, that masks are protective. And so 100% wearing masks, especially in indoor crowded places, I recommend. Now, when it comes to the issue of children, I think that's even more of a reason to wear a mask. And the reason why is that currently children under the age of 12 cannot be vaccinated. The vaccines have not been authorized for children below the age of 12. But children below the age of 12 can still get COVID. They can get it by going to school. They can get it from their families. They can get it from their friends. And we are now seeing with the Delta variant that more kids are actually becoming infected and being hospitalized. I think upwards of 15 to 20% of hospitalized patients in the United States are children. And children, though it's rare, are dying. And no one wants to see or have a niece, nephew, son, or daughter pass away from very, very preventable infection, especially when at the time they're not able to get protection via vaccine. So the best way that they can protect themselves now is being around people who are vaccinated, and then also wearing masks, especially in schools. And so I am team mask, and especially am team mask for children, only because at the moment they have no other way of really being protected in crowded settings.
Right, absolutely. I believe in wearing masks also, but I've known, I was just talking to a friend of mine, and her son goes to preschool, and he came back crying that everyone was laughing at him that you're wearing a mask. And she spoke about that on Twitter also, but a lot of mothers are facing the same dilemma, like where they feel that, the kids should be wearing masks, but sometimes the schools are against that. And a lot of kids, especially their parents, are against wearing masks.
Yeah, I mean, it's unfortunate how the virus has been so politicized in this country, so that wearing a mask becomes a symbol of your political leanings or how much you're willing to listen to other people, even if they're experts and have been studying this for the entirety of their lives. I would say at the end of the day, having your life and having your health is the most important thing, irrespective of how people think about you or view you. And it's going to be really up to parents and to teachers to show some leadership and say, hey, I care more about protecting my child than about what the parent to my left or the kid to my right thinks about what this mask means. And I would hope, I'm not a school administrator, but I would hope that schools are doing as good of a job as they can to encourage an atmosphere of acceptance. So even if another kid doesn't want to wear a mask or another parent doesn't want to wear a mask, like at least the ones who do, because of whatever reason, including some kids are actually immunocompromised. Like, you don't know, people's situations. People could have parents who are immunocompromised. So it's important for the kids to wear a mask. We don't know we don't know people's home situations. And so the best thing we can do is encourage an environment where we'll feel protected and empowered enough to do what they have to do to protect themselves and their families.
Right, absolutely. I agree with you. Another question that I wanted to ask was, and I know we spoke about this, that kids or people maybe can transmit the virus without having any symptoms, right?
Yeah, that's right.
Like they can be carriers, silent carriers, and they can wear masks, but still there's a chance that they can transmit the virus to someone who's immunocompromised?
So I would say this, wearing a mask severely reduces your ability to transmit the virus. And so that's why we wear masks. The reason why COVID-19 has been such a difficult virus to eradicate, as opposed to SARS, the original pandemic, or sort of original virus that almost caused a pandemic, is that COVID-19, you can be infected and have no symptoms or very mild symptoms and be very infectious. And so that means that there are a lot of people in the world who are walking around and feeling fine, but they're spreading COVID, or they have their nose is running and they have a little bit of a cough. And it turns out that that's the way that COVID manifested in them. Whereas other people get COVID and their lungs fail and they end up having to be intubated. And so that variation is so wide. And it's why there's this cognitive dissonance where a lot of people think COVID is just like the flu or another cold, because for a lot of people, that is what they felt. But at the same time, we have over 600,000 people who have died in this country. It's the data shows that COVID is actually quite deadly. And you don't want to roll the dice on your life in terms of whether or not COVID is going to be like a cold to you versus whether COVID is going to have you ending up in a hospital, in an ICU. And so that's why it's important for people to take this seriously and to protect themselves. And then we know that COVID is especially deadly for people with a bunch of comorbidities. So health conditions like hypertension, diabetes, obesity, people who are immunocompromised for lots of reasons, including taking medications that make you immunocompromised. Exactly. So, and we don't walk around life with cards showing what health conditions that we are carrying. And so you don't really know who you're putting at risk. So that's why, again, I think it's really important to wear a mask, not only to protect yourself, but also to protect other people, and then getting vaccinated so that you now have immunity or some protection against ending up in a hospital.
Right. So the next question would be that, can we mix different kinds of vaccines? Let's say if someone has taken one dose of Pfizer, can they then take the second dose of Moderna or some other vaccine?
So right now in the United States, that is not the policy, but I will say that there has been research being done in the UK and other places, including the US, to get a better sense of if people require another dose of vaccine or booster, can they mix and match vaccines? And the data shows that actually and this is experimental data, so this is not like policy yet, but scientists have done work showing that you can mix these vaccines and actually get just as good or even a stronger immune response from mixing AstraZeneca with like an mRNA vaccine specifically. And the reason why this research is being done is people want to understand in the future, if and when we need another shot, is it okay to just get whatever shot is available or recommended to you? So that is something that is coming down the line. But right now, the thinking and the policies that if you sign up to get Pfizer dose 1, you'll get Pfizer dose 2. Same with Moderna dose 1, Moderna dose 2. Johnson & Johnson is only 1 dose. And then AstraZeneca, again, is 2 doses. And future will have a better clarity on what the mixing and matching landscape will look like.
Right, because a lot of people, especially in the UK, and they travel to Dubai or UAE or Africa, sometimes they miss out on their doses, and then they're forced to take. For instance, I know a couple of people who took Sinopharm, and then they had to travel back, and then they took Pfizer. So far, the people I know are okay, but I just wanted to clarify. And just for the viewers, I think we will be posting all the links and the research papers that Dr. Akusobi is mentioning with this podcast, so that you can go and look up those resources.
Perfect.
Right. Another thing is that, what do you know about the side effects? Has CDC published any papers on or studies on the side effects of these vaccines?
Yeah, so when the vaccines were first emergency use authorized by the FDA, we knew what the most common side effects were because they were studied in the clinical trials. And so some of these common side effects are, people experience, the most common one is actually experiencing some like soreness in your arm where the shot went in. That is something we see with anyone who gets shots in their arms. Then you also have fevers, headaches, night sweats, people feel fatigued. These are all side effects that last for 1 to 2, maximum 3 days. They're self-limiting, which is our way of saying in medicine that the symptoms come and then they go without any intervention. It's expected. And the reason why you actually have these side effects is that it's a sign that your immune system is actually working. Once the immune system starts producing antibodies against this foreign spike protein, it creates this immune response, which is the fevers, chills, nights, some fatigue. And then it goes away and people feel completely fine.
Right.
In terms of side effects and the other thing I'll say is that the CDC is also monitoring for any long-term side effects of these vaccines, but we know from decades of research that any long-term effects of vaccines are seen in the first 3 weeks, and that so far people have been vaccinated for almost a year, hundreds of millions of people, and we're not seeing any really crazy, serious, long-term sort of side effects. These vaccines are actually quite safe. And just to reiterate the point, the mRNA that is in these vaccines are degraded in the body. They don't last for longer than 2 weeks. It comes and goes, and so we're not really expecting any sort of long-term side effects from these vaccines. But it's important to know that because when you get vaccinated, you kind of feel these symptoms. It's a sign that, for us, we know that it's supposed to happen, and it's also a sign that your immune system is working, and you should feel reassured that they'll go away.
Right. Okay, 2 more questions. One is that people think that spike protein somehow stays in your ovaries and causes infertility. Please, can you elaborate on that? And second is that these spike proteins can somehow alter the DNA. I think I mentioned that before also. So can you please clarify that how the vaccine works and how it does not affect the DNA?
Yeah, so when you get vaccinated, first of all, the answer to these questions is no. There's no evidence. There's no way this happens. Just to state that. But then to explain a little bit more. So when you get vaccinated, you get a shot in your arm. That shot in the arm has the particle that has the mRNA that enters your cell. It enters your muscle cell specifically. And this mRNA stays in the sort of neighborhood that is outside the nucleus of your cell. So the nucleus of your cell has DNA. The DNA carries your genetic information that is transmitted from generation to generation, and not in your muscle cells, but in your germ cells, the cells that go on to produce babies. But in your muscle cells, the mRNA does not enter the nucleus, which means it does not at all interact with or affect the DNA. It stays outside. And not only that, it gets degraded rapidly because mRNA is degraded rapidly in cells. That's part of the biology of mRNA. And so when you get vaccinated, the mRNA enters your muscle cells, and your muscle cells produce these spike proteins for as long as the mRNA is there. Once the spike proteins are produced, your immune system recognizes it as foreign because our bodies don't produce viral spike proteins. So the immune system recognizes it and says, hey, these spike proteins are weird. I've never seen them before. They're not from us. Let me make antibodies, which are molecules that can bind these spike proteins and basically target them for degradation, for them to be removed. Once the mRNA is degraded in your cells, these spike proteins are no longer produced. They no longer exist. But the immune cells that have recognized them earlier on now have a memory of these spike proteins having been there once upon a time. And that's how you get immunity that lasts for months to years. And that's, it's hard because immunology is one of the toughest topics in biology. So we're sort of asking the general public to understand virology and then immunology, which is even more complex. But I hope that explanation was simple enough, and that the main takeaway points is that the spike protein is produced, but then it's no longer produced because the mRNA is degraded, which means it's nowhere near your, and it's also nowhere near your ovaries. And not only that, it is not affecting your DNA because it's nowhere near your DNA. And mRNAs can't interact or change or influence, mutate DNA. That's just not the biology of mRNAs. And I can say that with certainty because this has been studied for 50 plus years. And there has been no evidence for decades in thousands of labs around the world that this happens. And so you can take that as a biological fact, that mRNAs are degraded and that they don't engage with or influence or mutate DNA.
So there is no way that a spike protein can somehow lodge itself, like they say, lodge itself inside the ovaries or in the fallopian tubes and cause what they describe as infertility or any sort of other gynecological problems.
No, and people have been getting pregnant who've been vaccinated this entire year. There's no evidence showing that fertility is affected. And if anything, getting vaccinated and being pregnant is much more safe to you as the individual and to you and to your growing baby. And so, yeah, spike protein, not there. And, I understand why this is an issue for people. It's scary. It's a new vaccine. Yeah. It's, and, having children is something that a lot of people want to have. And so know that this is something that scientists and medicine and doctors are taking very seriously. These are great questions. And as more research comes out, there'll be more definitive statements. But what we know now is that there's no impact on fertility, and there's no way that this vaccine is influencing mutating DNA.
Right. Also, again, two more questions, which I just remembered now. They were basically linked to the side effects, but I remember that initially when I think it was, there were very few incidents of Bell's palsy, and people were all over the place. I think it was with Moderna vaccine that there were a couple of, I think out of 1,000, there were 2 or less, probably. I'm not sure what the exact number was, but there were incidents of Bell's palsy, and I think endocarditis, which is basically the infection of the epithelium or the outside covering of the heart.
Yeah, so these, I know the data you're talking about. This is what I'll say, that the incidence or the rate at which people develop Bell's palsy in the vaccine trials was at the same rate that people develop Bell's palsy just in general, living life. And so this was something that they noted because this is what you have to do when you're doing clinical trials. You have to be very safe. So they noted it, but the rate at which it happened was at the baseline rate it happens in the population, which is to say, there's no way to know if it was at that time caused by the vaccines or just random chance. Now, since then, over 150 million people have been vaccinated, right? And so if the vaccines are actually leading to an increased rate of endocarditis and Bell's palsy, we would know that by now. We would see that by now. There would be studies, but that has not been the case at all. And in fact, the conversation about Bell's palsy and endocarditis completely died down and went away by January of this year, because it turns out that the vaccines don't actually increase any of that. And I talk a lot about US numbers, which is 150, 160 million. The world has 3 billion people, vaccines have been administered, right? The number is 3 billion. And so any adverse event that is very rare, we would know by now. And there's some that have been reported and people have investigated, like the AstraZeneca one. But when it comes to Bell's palsy, endocarditis, in the billions of people who have gotten vaccinated thus far, or shots that have been given so far, we haven't seen that. So it's a great question, and it was seen in clinical trials, but not in real life.
Right, and like we said before, I think there's there are lots of conspiracy theories out there. People are scared, and obviously, this was a pandemic. It impacted a lot of people in a lot of different ways, and I think that it's. Thank you so much for talking about this and explaining it in detail, because these are the conversations we need to have to sort of reassure people that these vaccines are safe and that there's no side effects that people think there are, and that also for the masks, right?
Yeah, I'm so glad you asked these questions on behalf of the general public and people who have concerns, because like I said earlier, this is the first time most of us are living through a pandemic in which we really need to rely on science and medicine to, help us out. But most people aren't thinking about scientific principles and medical principles that are this complex. And so people will rightfully have questions because it's their body. And we want to make sure that we inform people with actual, real, factual, correct data, so that when they make decisions, it's based on, real information and not misconceptions of things that aren't true.
Right. And that was the whole idea for this podcast, that I wanted to convey the right information that's grounded in science and research. And, we have the data backing whatever we're talking about. Thank you so much, Dr. Akusobi. Thank you for joining me today. And anything else that you would like to speak about that you feel is relevant, that we need to get out to the general public?
Yeah, I would just say in the age of social media, it's very easy for misinformation to spread. And it's very easy to have anyone open a browser or get on a radio and speak without really having the credibility or the knowledge base or the training to do so. And so it's part of living in the 21st century and in this day and age is to be able to discern who is giving information that that they're trained to give, and are the sources that I'm getting my information from actual sources that are based on fact. And so I would put it on everyone to really think critically about where you're getting information from and from whom, and to do your best to get it from actual sources that are based in science and research and rigorous thought and experimentation, and not from people who are coming from those backgrounds, because it's very easy in this day and age, like I said, to say anything, but that doesn't mean that what you're saying is true just because you have a megaphone.
Thank you so much. Yes, that's absolutely true. And also, there's this, I don't know, this, I would say, not hatred would be a very strong word, but just people have lost their trust, I feel, and their faith in science and science-based learning. I don't know why that's happened. Maybe because there's so much misinformation out there, and like you said, people can just open a browser and look at things. But generally speaking, people have developed this attitude of cynicism towards science and medicine, and I don't know why that's the case, but why do you think people are not listening to medical doctors and are more invested in, I don't know, these herbal medicine specialists and chiropractitioners, who, by the way, work in certain domains, but that's not scientific knowledge, that's not backed by data. But people somehow have lost faith in medicine.
Yeah, if we knew the answer to this, I feel like this pandemic could be a very different stage right now. I don't know. I think it's I would say it's probably due to a lot of reasons. The first is that the people with the biggest megaphones last year in the old administration did not really center scientists and center people with knowledge in the conversations. There's a political party that has been anti-science for a very long time, the Republican Party. And a lot of folks in parts of the country take their cues from political leaders or from their community members who have those viewpoints. And so because one party has just been anti-science for a long time, I think that translates to how country, especially more conservative red parts of the country, feel. It's like people on top sort of influencing that anti-science rhetoric. I also think science education in this country has just not been great for a very long time. And so, we aren't really being trained in our elementary, high school, and even colleges to be thinking about scientific thought and be thinking about logical reasoning in the same ways that other countries do. So there's partly education. And I think, and I don't want to put all the blame on other people, let's put some blame on scientists and doctors and researchers ourselves. There is a disconnect between the work that we do and then how we communicate it to the public. And I don't think that we show up in a lot of communities. I mean, I'm in Boston. A lot of people here are in this space. And so it's very easy for people in places like Boston to be interacting with and seeing and learning and listening to scientists, doctors. But there are a lot of places where that's basically not the case. It's much more rare. And we in the profession can do a much better job of being accessible, being present, being able to communicate with people, and to show that we're people too, and that there's not this notion of we know more and therefore do this. It's more so that, hey, we've studied this, we understand this, and we want you to understand this too, so that you can be at the same level that we are, and then make a choice that is then logical based off this information. So those are my like off the cuff sort of views on why so many of the country just doesn't believe in what is sort of in front of them.
You're right about the hate rhetoric. That was that's true. Thank you so much again for this detailed explanations, and I'm sure that a lot of people will be very grateful for the information that you provided. And thank you for coming on this podcast. I really appreciate it. And thank you for taking time out.
Thank you. Thank you for having me and for asking me all these questions.